Please excuse the wild hair. It is clean. But I'm on day 3 post-op. It's Friday, March 4th, 2022, and I had the surgery on the 2nd, so maybe it's not the 3rd day. I don't know. Anyway, I have been doing really well today. Last night was rough. I didn't take my meds. I don't know why, but I didn't. And I was having issues with nausea, and I threw up. That was horrible. I was pretty miserable last night, but I was able to go through and see what medications I needed to take, and a couple of them are for nausea, one is for inflammation, one is prevent blood clots, so they're kind of important. I don't know why I didn't think to take them before I went to bed. I bet it was because I'm at the hospital. Whenever I would take the pills they gave me, it would just feel like it would sit in my stomach and burn. It's the weirdest sensation. But yeah, honestly, all day today I've been really good. I'm on full liquids now, which means the liquids don't have to be clear, if that makes sense. So I can have cream of wheat, pudding. I can have cream soups as long as there's no chunks in them. I can blend it. I haven't blended any yet, but it's an option. What else? It still feels weird when I eat or drink anything, just because I can feel it going down into my stomach and burning. I talked to a nurse today and she said that's pretty normal, just based on the type of surgery that I had, and it's still kind of adjusting and healing. So that's why they do the clear liquids and the full liquids. And I'll do the full liquids for 2 weeks, and then I'll move to soft foods, which I really look forward to doing the soft foods. I think it's going to be eggs and stuff like that, so that'll be good. But I can be patient, especially because I don't really feel hungry, so it's different. I've had kind of a dry mouth, and I think that might be a side effect from one of the medications. I'm also kind of I'm having a hard time texting. I can't see that well. And then I realized one of the medicines, it says that a side effect could be blurry vision. So yeah, good thing I'm not working for a week. I'm taking next week off, and obviously these last couple days I took off. So hopefully by the time it's time to drive, I won't have to take that medication anymore. I feel mostly fine, except for when I'm trying to text. It's so weird. You can ask any of my friends that I've texted within the past couple days. It's been a mess. But other than that, I feel good. I'm wearing this binder that kind of holds my belly in place. I think it's supposed to help with for me, it helps decrease the discomfort and even pain when I'm moving around, maybe rolling in bed or something.
Mama, can I have yours?
Sure, it's just Gatorade.
Gatorade?
My daughter wanted a drink of my drink. Try not to spill. Is it yummy? Good. So, there's not really a ton to update on, but it's crazy. It's crazy to think that I just went in one day, and I think the surgery lasted 45 minutes or less, the actual surgery. So pretty crazy. My husband said it was really interesting because I was texting him about what was going on, and the next thing he knew, he was getting a call that I was out of surgery, for sure less than an hour, closer to less than 45 minutes. I guess the doctor does them all day long, so he knows what he's doing. And mine, I actually asked him afterwards, when he came the next day after I stayed the night in the hospital, I asked him how was my liver, because we had to do that 2-week pre-op diet to shrink your liver. So I was a little bit paranoid because I wasn't perfect on the diet. He was oh yeah, I didn't even have to move your liver. So that's good, no fatty liver here. But that was a bit of a concern, because they said that they could actually potentially cancel your surgery if they start to go in there and your liver was too difficult to move around, I guess. So that was good. I met a bunch of other people that were also getting bariatric surgeries in the hospital. They were hanging out in the halls, so I went and hung out with them, and it was fun. We got each other's contact information, so hopefully we can sort of stay in touch and just see how each other's doing and support each other. There is a Facebook group that we are all on for those that had got surgery by our surgeons at the specific clinic. And so it's been good. My husband has been really, really supportive. He's been like really taking care of me, you know, like asking me what I need and doing stuff like that. And I'm not gonna lie, I kind of like it. It's nice to be taken care of a little bit. But overall, I'm sure I'll have more to update as the days progress. And yeah, I just look forward to seeing like the changes. In terms of like weighing myself, I already know that I've gained weight after the surgery because of all the fluids that are in me. Like I feel swollen. I did actually weigh myself this morning, and I was like, I think I gained like 6 or 7 pounds in the surgery, and I wasn't eating. So I know that it's nothing to do with like what I did. I think it's just the fluids that they pump you with. So I'm not going to be weighing myself like every day. I think for a little while I might do it weekly just to kind of keep up on progress and see how things are going. But I think also in a couple weeks I can meet with a dietitian and see if she has any tips and, you know, feedback on the way I've been eating or things like that. So I'm really excited. This is crazy. I think it's also kind of fun because I know that I've set some like kind of milestone goals, and whenever I hit them, I get like a treat, not a food treat, but like after I think 50 pounds, I'm gonna get a new swimsuit, or 20 pounds, a new pair of shoes. And there was something else, but I don't remember what it was. But at the time, it seemed like something I really wanted, that it would be worth, it'd be an equivalent reward for, the progress. So yeah, I went in actually to get an IV today because I had it scheduled, and they couldn't find my veins. Like, yeah, I have a big bruise there now. They tried the top of my hand, they tried my arm, and they couldn't find anything. They couldn't find a place to put the needle. So basically they sent me home, and they were like, they basically told me that I could drink like full sugar Gatorade since I'm not getting the IV at this time. And she talked to the other girls, but not the ones that had the duodenal switch. She said the ones that, if you had the vertical sleeve hysterectomy, it's okay to have some sugar, especially if you're not able to get the IV in. But they said check in again on Monday. Like if I am feeling weak or lightheaded or anything like that, it might be good to go get hydrated with an IV. So yeah, I'm feeling good about where things are at, and I'm happy that I get to take off work and just kind of like take it easy for a week. So I can just focus on like taking care of my body and like what I need. And it has been tempting already to check my work emails, but I'm 90% sure that I won't, which means I probably will at some point. But yeah, thank you for watching. Thank you for supporting me, and I will see you next time. Bye.